topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, San Antonio. Welcome to another Ask the Expert show. 16 years doing the Ask the Expert show, still going strong. We are all across the country. Today's show, our San Antonio show, it's an important show to me because I'm on Medicare and I had so many problems. First of all, mainly because I was uneducated. And it really bothered me, all the emails that we got from the San Antonio area saying, how come you're not doing a show on Medicare? And we actually added more time to San Antonio so I could get a Medicare expert. We found one, the Medicare Gals. Good morning, Susan Schimpf.
Good morning. Thanks for having me, Steve.
I'm so glad that we have you. And what's amazing, for some reason, I'm sure you've heard this, I want to call you Susan Shrimp.
Everybody does, yes.
But it's not. It's Schimpf. That's what it is.
There's no R.
It's so easy, but Susan, I can't tell you how glad we are to have you because I didn't know until a friend of mine said, well, you're on Medicare, aren't you? And I went, no. Why not? And I was so uneducated. And that's what's going to be so important about a show like this. So I missed a whole year. You know what that means. I was penalized.
Penalty.
Yep. But that's why this show, of all the different shows we do, is so important because I want people educated. First of all, tell everybody about Medicare Gals.
Well, we are a local office in New Braunfels, Texas. I do live in San Antonio. We have been doing Medicare for 11 years. So we are very enthralled in Medicare, very informed in Medicare. And we just are a local resource center that you can come to ask questions, to sign up for Medicare, get the questions answered that you missed out on, and also just like be a place for the public to come to. Because Medicare, like you said, is so confusing. So it's very important that we educate people. That's the number one goal, is education on Medicare.
Absolutely. And I got to tell you that it's so important that you get a good agent like you, Susan, because the first agent I had here in Florida was horrible. I had to call him when he should have been calling me.
Yeah.
And, especially, you see all these commercials on TV and we are going to give you this and we're going to give you that. And I'm going, well, why isn't my agent at least explaining any of this to me? Well, of course, I got rid of him, but it's so important not only to learn about Medicare, but to get a good agent like you, Susan.
Yeah. And that's the thing, is like the stuff you see on TV, those are the shiny objects that they're dangling in front of your face, right? So
the carrot.
It's intriguing, right? You want to call the number, say, I want that grocery card. I want that gas card.
Yes.
But then they, talk to you about it. And then if you don't have certain income levels, then you don't qualify for that, right? So, that's where we as agents be like, before you call that 1-800 number, call us. We'll explain it to you, because what they're going to try to do is they're going to try to get your information. They're going to then sell your information once they get your information, and they're going to try to flip you onto a different plan. And so therefore we ask, call us first. We'll tell you the right, the wrong, if we can get you on that plan. And we're not selling your information. We're not one of those call centers.
Well, gosh, I can't believe this is pretty good for the first show. We've already gotten 2 texts already
All
because you
right.
started promoting your show 2 days ago. The first one is from Mark. He wants to know, I am being inundated by calls about Medicare. Why am I being inundated?
Well, welcome to Medicare. As soon as you hit like 64, they're going to start hitting you up. They're basically are vultures all across the country wanting to get you as a client. And their call centers, there's, the insurance companies, all that stuff. They buy books of business and they buy Medicare books, people turning 65. And they basically call you to try to get you enrolled, right? They're trying to make money that's based on quotas. It's based on all these numbers. Whereas when you get on Medicare, you want to work with somebody local. You want to work with somebody in the local market. 1, they know your doctors. 2, they know the plans. If you're getting calls from all across the country, they don't know specific to your market, to your doctors, to the plans. They're just blindly enrolling you into something that they want to make money off of.
The second text we got is from Catherine. Thank God for a show like this. I'm one of the people who've been writing you constantly to bring a show like this on. My question is to your expert is, do you represent multiple companies?
Yes, ma'am. So I am a broker. So I am contracted with numerous insurance carriers. As a broker, we are your fiduciary. So we are in your best interest, not in the insurance company's best interest. So we look at all the plans side by side, look at your doctors, look at your prescriptions, and we basically see what's the best fit for you, because what is good for your neighbor or your friend is not just good for you. So all plans are different. Everyone's medications are different. Everyone's doctors are different. Everyone's needs are different. So therefore, we need to make sure that we are brokers and selling all the options so that you become our client.
Susan, I'm going to tell you, I hear some people complain about Medicare, and I'm going to tell you, I have had nothing but great experiences with Medicare from the doctors that I've used, everything. And there was people out there with scary tactics. Oh, you're going to have to wait 6 months to see a doctor. It was all BS. And I got to tell you, if you're getting ready to go on Medicare, I'm telling you, you're going to love it. So tell people, first of all, because we're finding in our other markets that we've started a Medicare show on, is what is the difference between Medicare and Medicaid?
Good question. It's so confusing because the names are very similar, right? And so
Yes.
people call them one for the other. So Medicare is a federal government health insurance that you get when you turn 65, no matter what, okay? Medicaid is through usually the state, and it's based on income. So the lower income, you can apply through the state of Texas, for example, and based on your income, you can get Medicaid, and that is for low income. There's different levels of Medicaid based on your income, but you have to apply for that through the state. That's not just given to you. So therefore, that's the difference. Medicare is federal government. Medicaid is state government.
Okay, so now who is eligible to enroll in the Medicare?
So Medicare is primarily for people who are turning 65. However, if you are on Social Security disability and you've been on that for 2 years, no matter what age you are, 34, 50, doesn't matter. But if you've been on Social Security disability for 2 years, you automatically get enrolled into Medicare on the 25th month. But primarily it's for people turning 65.
What about if you're still working?
Good question. So if you're still working and you have credible employer coverage and you decide to work past 65, you can continue to work. You don't have to draw Medicare as long as you have credible health insurance coverage through your work or through a spouse's work and they're still working. Now, the key is the employer must have more than 20 employees in order to keep that credible coverage before delaying Medicare. So therefore, say you're 67 and you decide to retire and you're like, okay, now it's time for me to sign up for Medicare. There's forms that you have to fill out to prove that you've had credible coverage for those 2 years delaying Medicare at 65 because you're now 67. And it would prove to Social Security and Medicare that you've been covered and you don't get a penalty and you just move into Medicare without any issues.
Now, we're hearing about open enrollment. Explain that. What is open enrollment and when does it start?
So the annual enrollment period, yes, this is the time of year that it gets really, really busy. This is the time of the year that everyone has a chance who is already on Medicare to review their plan for the changes for next year. So October 15th through December 7th, those are the key dates, October 15th through December 7th. This is the time of year that anyone who wants to see what the changes are for 2026 can review their plans. I specifically review with all my clients. I hold member meetings, talking about all the changes. I do one-on-one appointments. We do Zoom, we do phone calls, everything for all my clients, because what is good this year may not be good for next year. So you have to review, no matter if you love your plan or not. You always want to review because there's some kind of change that might affect you.
You know, since this happened to me, explain what happens if you miss, if you miss the open.
If you miss the Medicare enrollment.
Yeah.
So if you are 65 and say you're not working, or you are working, but you don't have any employer coverage, you are required to get on Medicare. If you're working with credible coverage, you don't have to get on Medicare. So 65 and still working, or 65 and not working, you have to get on Medicare. If you do not get on Medicare, you have a 7-month window, 7 months, 3 months before you turn 65, the month of your birthday, and 3 months after. So 7-month window to get into Medicare. It's your initial enrollment period. If you do not sign up during that 7-month window and you don't have any employer coverage, or you're not working, you will be penalized if you go past that 7-month window. If you go past that 7-month window, you can't just say, oh no, I forgot, let me sign up for Medicare now. You can't. You got to wait for the general enrollment period, which is January of next year. And you have January, February, and March. If you enroll during that time, you get penalized. It's 10% a year for every year that you do not enroll into Medicare. So don't delay. Don't be a Steve.
Please. I'm so embarrassed.
It happens. It happens.
We just got a text in. Thank you so much for the show. I'm so glad there's finally a show out there. Please ask your expert. I live in a 55 plus community in San Antonio. Does she come to the community to make an open presentation? Ooh, that's a good question.
That's a good question. And yes, I do. So I would have to coordinate that with the complex in order to do a presentation. But I do that several locations around San Antonio, New Braunfels area. A lot of people just have a lot of questions and they prefer to do it as a group, because if a question is asked and you're like, oh, I didn't even think about that, that's a good question. So it's good to have it in a group. And then you get to know me, and then we can then set up a one-on-one afterwards to kind of fine tune your needs. But yes, I would love to do presentations. I do those all the time and actually love doing those.
I hope you will take this as a compliment. Um, Susan used to be a newscaster. It's so obvious. I just want to tell you that you're so good at your responses.
Thank you.
I just wanted to throw that in. So, so hey, listen. While we were talking about coming in and talking to a group. Give people your phone number since so many people are listening on our radio and iHeart and
Yeah,
Spotify right now.
absolutely. So my number is 210-767-9876. So if you call that number, I do have a team that works with me, Miriam Soto and Brenda Stone. They work with me as well. They're licensed agents. They help me because I'm not always available all the time. So I need to have a team of agents that, I've trained and they know the ins and outs of Medicare just like I do. And we're all willing to help you.
Okay. What about are there other special enrollment opportunities outside of the main deadlines?
So yes, so there are, if you're on a Medicare Advantage plan, which we can kind of get into that maybe another show, but Medicare Advantage plan,
That's me.
January through March, you do have another open enrollment window after the annual enrollment. So annual enrollment's October 15th through December 7th. That's for everybody on Medicare. Then you have January 1st through March 31st called the open enrollment window, which anyone on Medicare Advantage can make another change to their plan for the rest of the year. However, there are special enrollments throughout the year that you could also make changes if you're outside of the window. So for example, say you moved out of the San Antonio service area and you moved to the Austin area, or you moved to Houston, or you moved to Indiana, you have a special enrollment to change into a different Medicare plan. Say you were diagnosed with a chronic condition and diabetes. In Texas, they consider 3: diabetes, congestive heart failure, and cardiovascular disease. So those 3, if you diagnosed with those, that's a special enrollment to get into another plan. Also, there are special enrollments due to weather disasters. Those aren't specifically announced a lot, but they are available. So for example, we've been in a drought for years here in San Antonio. So that is a special enrollment. If there's a hurricane, if there is flooding, which unfortunately with the flooding back in July, that consisted of a special enrollment. So there's always ways to make changes on your plan if something needs to be changed. And that's where I come in. You can call me and we can figure it out to see if there's an available special enrollment for you.
Susan, explain to everybody about Part A, B, C, and D, if you would.
It's alphabet soup, basically, for Medicare, A through Z. Part A is your hospital. That covers all your hospital and inpatient care. Part B is your medical and your doctor visits and all your outpatient care, okay? Part D is your prescription drugs, D for drugs, and C is all of that combined into one plan called the Medicare Advantage. So I always say it's A plus B plus D equals C.
Well, that's the one I'm on. I'm on the Humana Advantage plan, and but there's so many good plans out there.
So many, yes.
And from what I understand, it goes by your zip code.
It does. Right? It goes by your zip code in your county. So it's funny because San Antonio service area is from Comal County down to like Medina, Wilson kind of area. And then if you go from Hayes County up, that's the Austin service area. So people who live on the border, it depends on the county, not the zip code. So yes.
We just got a text from somebody who's listening in Laredo.
All right.
They want to know that if they're in Laredo and you're in San Antonio, I know the answer to this, but I'm going to let you answer. Can you still help them?
Absolutely. I actually have a lot of clients down there, and it's really just kind of, doing a needs analysis with you, getting to know your needs, getting to know who your doctors are, your prescriptions, what you're looking for. So we basically cater everything to you, and absolutely I can help you. You just give us a call. We can look at your options, the plans, and then we become your patient advocate. That's the nice thing, is we don't just sign you up and say bye. We are there for you always. You have our direct cell phone. You have our contact with our email. We send out newsletters constantly. We're always doing something and, making sure that you stay up to date with all the Medicare changes. So yes, I can definitely help you.
So how can someone know if their doctor or their prescriptions are covered under a plan?
So you can look it up yourself, but it might take you hours. We
Yes.
can look it up. It takes us like less than 5 minutes. So, that's where we look at your doctors and prescriptions, and we make everything fit like a glove. And we know the doctors, what plans the doctors take. We know the networks. We know all this stuff. We've been doing it 11 years. So we're very in tune with the insurance companies and what the doctors take and what they prefer and all that good stuff. So that's easy for us. You can do it, but it might take you a little while.
So my friend is on a PPO, loves it, loves the fact that she can go to whatever doctor she wants.
Yes.
Whereas I'm on the HMO,
Yeah.
and I have to go with the doctors in the plan. And I got to tell you, I have loved every specialist. So it's not a big deal
It's
either
not.
way you go.
It's not.
And I'm going to say this, and I don't mind admitting it. I'm on Ozempic, and the plan that I'm on, you hear about how expensive.
Yeah.
They call them the skinny injection. They tell you how expensive they are, and they are. But with my plan, for 6 months, I paid a $30 copay
Copay.
for the
Yeah.
month, which is amazing. And then for the final 6 months, I don't pay anything.
Nothing.
So you
Yeah.
can see this. You want to jump on this. And like I said, it's so important that you have a good agent like Susan. That's you got to have help. I just
Yeah, you
there's
have
so
to.
many questions that people have. I could just tell by the questions that are coming in right now, the questions people have. Susan, tell people how again they can reach you in your website.
Absolutely. So we're the Medicare Gals, the signature team. Our website is Medicare Gals with an S dash ST, that's signature team.com. Medicare Gals dash ST.com. Phone number 210-767-9876.
Susan, what a great job. We're so blessed to have you. We will see you again next month.
Sounds good. I'm excited for it.
Thank you. That's Susan Shimp. Thanks, Susan. And we're going to go to break. We'll be back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.